The labyrinth of memory. Defining amnesia, Alzheimer's, and dementia. Memory. It is the thread that weaves together the tapestry of our lives. It holds our experiences, our loves, our very identities. But what happens when this precious faculty begins to fray? When the mind, once a vibrant library of memories, starts to lose its books, its shelves, its very structure. Amnesia, Alzheimer's disease, and dementia. These are words that strike fear into the hearts of many, conjuring images of a life unraveled, a mind adrift. But while these conditions all affect memory and cognitive function, they are distinct entities with their own causes, symptoms, and prognoses. Understanding these differences is the first step in navigating the labyrinth of memory loss. Amnesia, often portrayed in movies as a sudden loss of identity, is actually a rare condition. It involves a specific impairment in the ability to form new memories or recall past events. Imagine waking up one day and not recognizing your loved ones, your home, even your reflection in the mirror. This is the terrifying reality for individuals experiencing amnesia. Alzheimer's disease, on the other hand, is a progressive neurodegenerative disorder, a slow and insidious thief that robs the mind of its memories, its functions, and ultimately, its very essence. It is the most common form of dementia, a broader term encompassing a range of conditions affecting thinking, behavior, and the ability to perform everyday tasks. Dementia is not a single disease, but rather a syndrome, a constellation of symptoms indicating a decline in cognitive abilities. Imagine a garden slowly being overtaken by weeds, the once vibrant flowers and lush foliage choked out by unwanted growth. Dementia, in its various forms, gradually encroaches upon the mind, impairing memory, judgment, language, and thought processes. While these conditions present unique challenges, they also share a common thread: the erosion of memory and the profound impact this has on individuals, families, and society as a whole. Understanding these conditions, their causes, and the early warning signs is crucial for early detection, intervention, and providing the best possible care and support for those affected. The causes of memory loss are as varied as the memories themselves. Unraveling the threads of these conditions requires delving into the intricate workings of the brain, a complex organ vulnerable to a multitude of insults. Amnesia, often depicted in dramatic fashion, typically results from a specific event, such as a traumatic brain injury, a severe infection, or a stroke. These events can disrupt the brain's ability to form, store, or retrieve memories, leaving individuals stranded in a sea of forgotten experiences. Alzheimer's disease, a far more prevalent and devastating condition, arises from a complex interplay of genetic and environmental factors. The brains of individuals with Alzheimer's exhibit a buildup of amyloid plaques and tau tangles, abnormal protein deposits that disrupt communication between brain cells and ultimately lead to their death. Imagine a city's power grid slowly becoming overloaded, circuits shorting out, and lights flickering and dying. This is akin to the devastating impact of Alzheimer's on the brain. Dementia, the broader umbrella term, encompasses a range of conditions with diverse causes. Some forms, like vascular dementia, arise from impaired blood flow to the brain, often due to stroke or other vascular problems. Others, like Lewy body dementia, involve the accumulation of abnormal protein deposits called Lewy bodies, which disrupt brain function. Understanding the causes of these conditions is crucial for developing effective treatments and prevention strategies. While we may not yet have all the answers, research continues to shed light on the intricate mechanisms underlying memory loss, offering hope for a future where these conditions can be prevented, slowed, or even reversed. In the realm of memory disorders, early detection is paramount. Just as a stitch in time saves 9, recognizing the subtle warning signs of cognitive decline can make a world of difference in managing these conditions and preserving quality of life. Amnesia, often sudden and dramatic, presents with clear signs: difficulty forming new memories, forgetting recent events, or experiencing confusion about one's identity or whereabouts. Imagine misplacing your keys one day, your wallet the next, and then forgetting your own address. While occasional forgetfulness is normal, persistent and significant memory lapses warrant attention. Alzheimer's disease, a stealthy thief, often announces its presence with subtle clues. Difficulty remembering recent conversations, appointments, or names can be early indicators. Changes in mood, personality, or behavior, such as increased confusion, anxiety, or withdrawal, can also signal a problem. Imagine a loved one, once vibrant and engaged, becoming increasingly withdrawn, their spark dimming as the shadows of forgetfulness lengthen. Dementia, a broader category, manifests in a variety of ways depending on the underlying cause. Memory problems, particularly with short-term recall, are common across dementia types. Difficulties with language, problem-solving, and decision-making can also emerge. Changes in visual perception, spatial awareness, and coordination may also occur. Imagine struggling to find the right words, getting lost in familiar surroundings, or having difficulty completing once routine tasks. These early signs, while concerning, should not be met with fear, but rather with proactive action. Seeking prompt medical evaluation is crucial to determine the underlying cause of these symptoms and explore appropriate treatment options. Early intervention can often slow the progression of these conditions, providing individuals and their families with precious time and support. Section 4. Navigating the maze. Treatment options and support. Navigating the maze of memory disorders can feel daunting, but even within the labyrinth, there are paths towards support, management, and improved quality of life. While a cure for these conditions remains elusive, a multifaceted approach encompassing medication, therapy, and lifestyle modifications can make a significant difference. For amnesia, treatment focuses on addressing the underlying cause, such as treating an infection, surgery for a brain injury, or rehabilitation following a stroke. While lost memories may not always be recoverable, therapy can help individuals develop coping mechanisms and strategies to compensate for memory deficits. Alzheimer's disease, a progressive condition, currently has no cure, but medications are available to help manage symptoms and slow cognitive decline. Cholinesterase inhibitors and memantine, commonly prescribed drugs, work by bolstering communication between brain cells. While these medications cannot reverse the damage already done, they can provide temporary relief from symptoms, allowing individuals to maintain a degree of independence and quality of life for a longer period. Dementia, a diverse group of disorders, requires tailored treatment plans based on the underlying cause. Medications may be prescribed to address specific symptoms, such as memory loss, agitation, or sleep disturbances. Non-drug approaches, such as occupational therapy, speech therapy, and cognitive stimulation can help individuals maintain cognitive function and independence. Beyond medication and therapy, support for both individuals with memory disorders and their caregivers is essential. Support groups, counselling, and respite care can provide emotional support, practical advice, and much-needed breaks for caregivers. Creating a supportive and nurturing environment is crucial for enhancing quality of life and fostering a sense of purpose and well-being. Section 5. Preserving memories. Tips for prevention and brain health. While the spectre of memory loss can cast a long shadow, there are proactive steps we can all take to safeguard our cognitive health and potentially reduce our risk. Just as we nourish our bodies with healthy foods and exercise, we can cultivate habits that nurture our brains and promote cognitive resilience. Such as reading, puzzles, learning a new language, or playing a musical instrument, can help keep our minds sharp. Social interaction, staying connected with loved ones, and participating in meaningful activities can also protect against cognitive decline. Managing stress through relaxation techniques such as meditation, yoga, or spending time in nature can reduce the negative impact of stress hormones on the brain. Adequate sleep, crucial for memory consolidation and brain health, should be a priority. While we cannot control every factor that contributes to memory disorders, embracing these lifestyle modifications empowers us to take an active role in safeguarding our cognitive health. By making conscious choices that prioritize brain health, we invest in our future well-being and potentially reduce our risk of developing these debilitating conditions.